Hi, Dr. Dyke Drummond here from thehappymd.com, and let me show you a 4-part organization-wide proactive physician burnout prevention program. I call it the Physician Engagement Formula, and at this point, it is the best practice for burnout prevention in large organizations. Here are the 4 parts of the physician engagement formula. Number 1 is education. All of your physicians have a hole in their medical education with regards to stress, stress management, and burnout prevention. The first thing we have to do is, across the entire organization, fill that hole so that your doctors understand what stress feels like, the symptoms of burnout, and practical, real-world tested tools to prevent burnout in the first place. In the course of this education, too, what we do is change the culture by normalizing the discussion about stress and burnout. We can talk about it, perhaps, for the first time. It's important that this education come in several different fashions: live trainings, the book for a home resource, and video trainings that people can access from your intranet website 24/7 for refreshers, and roll this into your onboarding process as well, so that from this point forward, everybody in the organization understands burnout at a whole new level. That's step number 1, education. Step number 2 is meaningful quality improvement activities. The quickest way to understand how to help your people is to survey them. I recommend you use short surveys that ask questions that give you actionable information. Simple ones like, what are the top 3 stressors in your workday? And then create for yourself a special committee inside the physician leadership structure. The ideal name in my mind is the Physician Burnout Prevention Working Group. And the answers to the survey questions are that working group's project list. Create small innovation centers. The bigger your organization is and the more spread out you are, it's important to create small innovation centers where, when you perfect an improvement in the care or documentation flow, you can then disseminate it out to the larger organization. Once the educational hole is filled, though, you have to give them meaningful change in the systems of care, or we don't make any real changes in their stress levels. That's step number 2. Step number 3 is to support the doctors getting together in social interactions. Back in the day, before the mergers and acquisitions that created your group, physicians owned their own practices, and we used to have meals together and party together. And it's that camaraderie that's missing today that is a large source of the burnout that we're seeing. So have a small budget and be creative with ways that the physicians and their spouses and significant others can get together regularly outside of the workplace. And make it cool to attend those activities again. That's step number 3. And lastly, step number 4 is crisis intervention. There's 2 different flavors of this. Every organization should have a 24/7 manned physician hotline where physicians who are burned out and feel that they need immediate support can call and get an intake, interview, and resources immediately. I also believe it's really important to have what I call a hot dish bad outcome delivery team. We all know there's going to be bad outcomes in the organization, probably happening right now as you listen to this video. Medical errors, bad outcomes, malpractice cases, things that traumatize the doctor in your organization, rather than allow them to be isolated and allow them to be avoided when these bad things happen. Let's have a team of people deliver a hot dish, sit on their front porch, offer to support them in any way they need in this time of trouble. So that's the physician engagement formula. Fill the educational hole. Survey your people and create meaningful quality improvement activities. Support them getting together socially as a group, and have meaningful crisis intervention. With those 4 tools in place on an ongoing basis, you have a functioning, organization-wide burnout prevention program. If you'd like more details, the entire physician engagement formula is down below this video screen in a link. I encourage you to click it now. And if you have any questions, my contact information is below this frame as well. That's it for now. I hope to be talking to you real soon and that we can get your people the burnout prevention that they need. Keep breathing and have a great rest of your day.